Good everyone. Let's continue our visual diagnosis, cold sore. Visual diagnosis of the mouth. If the mouth is skewed without there being a history of physical trauma in the region, the distorted shape may be due to an invasion of wind cold blocking the movement of qi and blood in the local area of wind phlegm, creating a chaotic movement of qi and blocking qi and blood in the area. If there is a history of physical trauma to the area, the distortion will be due to local stagnation of qi and blood. If the person draws from the corners of their mouth, this can be due to spleen and or lung qi deficiency. The qi deficiency results in yin accumulating in the mouth and an overproduction of saliva. Internal wind can cause paralysis of the muscles around the mouth. This means that the lips cannot hold the saliva in the mouth. In this situation, the saliva will usually only dribble from the one side of the mouth. An invasion of wind can also block the movement of qi in the area, resulting in a unilateral paralysis and subsequent dribbling from this side of the mouth. Heat in the stomach can drive fluid from the stomach up to the mouth so that there is an overproduction of saliva. In a small children, the pattern of stomach heat can be caused by the accumulation of parasites in the digestive system. Observation of the mouth. Distortion of the mouth. The significance is wind cold, wind phlegm, blood stagnation. In observation of dribbling from the mouth, the significance is wind cold, internal wind, spleen, and or lung qi deficiency, stomach heat, and parasites. The mouth and the lips are related to the spleen. Chapter 37 of the Spiritual Axis says, the mouth and the lips are the orifice of the spleen. In chapter 17 of the Spiritual Axis says, the spleen open into the mouth. When the spleen is harmonized, the mouth can distinguish the 5 flavors. The mouth and the lips are primarily influenced by the stomach and the large intestine channels. The liver channels wraps around the lips and so do the penetrating and directing vessels. Internally, other channels flow to the inside of the mouth and the tongue, and in particular, the heart connecting channels, the kidney, main and divergent channel, and the spleen main channel. The saliva is the most under the control of stomach, spleen, and kidney, and the normal moisture of the mouth indicates a normal state of the body fluids. Cold sores. Cold sores are generally related to the stomach channel and reflect full heat, empty heat, or qi deficiency. When due to stomach heat, the cold sores appear suddenly and cause a burning pain. When due to stomach empty heat, they come in bouts, recurring over many years. When due to qi deficiency, they occur in bouts over a long period of time, are usually pale in color, and are aggravated by overwork. A sudden attack of cold sores at the corner of the mouth or on the edge of the upper lip may be due to an external invasion of wind heat. Chronic or recurrent cold sore at the corner of the mouth or on the edge of the lips, lower lip may be caused by a stomach pathology. Either damp heat or yin deficiency with empty heat or damp heat in the large intestine may also cause cold sore, which in this case would be an upper lip, on the upper lip. Okay, treatment note for cold sore. Li4, stomach 44, and stomach 4. Full, invasion of wind heat. Cold sores at the corner of the mouth or on the edge of the upper lip. Aversion to cold, fever, cough, sore throat, stuffed or runny nose with yellow discharge, headache, body ache, light sweating, light thirst, swollen tonsils, tongue with slightly red on the sides in the chest area or on the front part, and the pulse is floating rapid. In acupuncture, this is the points: Li4, triple burner 5, bladder 12, lung 7, and Li11. Okay, let's talk about damp heat in the stomach. Cold sores at the corner of the mouth or on the edge of the lower lip. A sticky taste, thirst with no desire to drink, facial pain, stuffed nose, or thick, sticky nasal discharge, a feeling of fullness and pain of the epigastrium, a feeling of heaviness, nausea, a feeling of heat, dull yellow complexion, and the tongue is red with sticky yellow coating, and the pulse is slippery, rapid. In acupuncture points, REN 12, REN 9, spleen 9, Li 11, REN 5, and bladder 22. Okay, empty and full. Stomach yin deficiency with empty heat. Cold sore at the corner of the mouth or on the edge of the lower lip. Dry mouth in the evening. Dull or burning epigastric pain. Feeling of heat in the afternoon. Thirst with desire to drink in small sips. Dry stools. Slight feeling of fullness after eating. Night sweating. 5 palm heat. Bleeding gums. Red tongue. Or red center only, without coating in the center. And the pulse is floating empty and rapid. In acupuncture point, stomach 44, spleen 6, REN 12, stomach 36, large intestine 4, large intestine 11. Stomach heat, cold sores at the corner of the mouth or on the edge of the lower lip. Foul breath, thirst, burning epigastric pain, sour regurgitation, nausea, excessive hunger, a feeling of heat. The tongue is red with a yellow coating, and the pulse is overflowing rapid. Okay, let's talk about heat in the large intestine. Cold sores on the upper lip. Constipation with dry stool. Burning sensation in the mouth. Dry tongue. Burning and swelling in anus. Scanty dark urine. Thick yellow or brown or black. Dry tongue coating. And the pulse is full, rapid, often wiry on both rear position. Okay, damp heat in the large intestine. Cold sores on the upper lip, abdominal pain that is not relieved by a bowel movement, diarrhea, mucus and blood in stools, offensive odor of stools, burning in the anus. scanty dark urine, fever, sweating that does not decrease the fever, a feeling of heat, thirst without a desire to drink, a feeling of heaviness of the body and limbs, a feeling of oppression of the chest and epigastrium, and the tongue is red with sticky yellow coating. And slippery rapid pulse or pulse that is slippery and wiry on both rear positions. There's a clinical note. I use LI4, large intestine 4, contralaterally for the corners of the mouth, that is on the left for the cold sore, on the right, and vice versa. Thank you for your listening. Thank you for your time. Have a good day, everybody.